Every single week they come, right? And there's a value there because we're not offering haircuts or gift cards or anything. They're coming because of the value of the space. And the trust that I built has helped us tackle some topics like organ and tissue donation. Because when I said that was a topic, man, they were like, heck nah, we ain't talking about that. Like, I'm not going to be a donor. But, having that time for them to open up and listen to me and listen to what I had to say, it really changed a lot of minds that day. Leadership, anyone could be a leader. I had 2 patients at the bedside in the ICU. I was a leader, right? I was a leader, right? My title didn't make me a leader. My actions made me a leader.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode of You Belong in Here. I am Dr. Tiffany C. Brown, your host. I am thrilled today to introduce you to my guest for today's episode entitled Shifting Perspectives, Black Male Voices in Nursing Leadership. So let me get right into it and let me tell you about my guest. Aaron King is an assistant manager at a Northern California hospital and is pursuing his PhD in nursing science and healthcare leadership at UC Davis. He also earned his Master's of Science there as well. As the historian for the Capital City Black Nurses Association and recipient of the National Black Nurses Association 40 Under 40, he advocates for diversity in nursing. Aaron co-founded Barbershop Health Talks to address healthcare disparities in the Black community and partnered with the National Association of Hispanic Nurses to launch the Breaking Down Barriers to Nursing virtual program that attracted over 250 students. His doctoral dissertation focuses on the Cut to the Chase program, which aims to enhance the well-being of Black males in Sacramento through counseling and support in barbershops. Aaron is a genuine innovator and catalyst for change in the nursing field. So welcome, Aaron. I am so glad to have you today as my guest.
Hello. Thank you so much.
So, I do have a lot of questions, for you for this interview. Can you start by sharing a little bit about your beginning, which I like to call your genesis? And by this, I mean your journey into nursing and what inspired you to pursue a career in the nursing field?
Yeah, so I think my interest really started in high school. So I was like the guy that was really, really into science. I really loved that subject in high school. And I was in a program that really, like my class really focused in on the science. And one of my teachers was like, what would be really interesting? I think, you should look into our health academy. And so the health academy, we had a health academy and business academy, and the health academy kind of just really shadowed different professions in healthcare. And of course, you're telling that to a young boy. So I'm thinking, oh, okay, well, maybe I'll be a doctor. I don't know. But we started learning medical terminology. We got to visit and shadow in the hospital. We followed all kinds of different health professions, from radiology techs to actual radiologists. We were in the OR. We went to labor and delivery. We went all these different places. We were in the lab. And all the jobs that were really, really interesting, I was like, oh, what do you do? And they're like, oh, I'm a nurse. And so I was like, you know what? Maybe I'll do nursing, because I feel like everybody kind of doing the cool things, like in the OR or in labor and delivery, they were all nurses. And so that's what really first got me interested in nursing. And so right out of high school, I started over at the community college and started my prereqs.
Awesome. That is great. I kind of want to talk about something interesting that I read about the challenges of African American men being like unicorns in the health field. So in a journal article published by the Journal of Professional Nursing called Looking for a Unicorn, the challenges of studying African American men enrolled in pre-licensure nursing programs, they highlighted something that we already know, which is African American men are underrepresented in nursing programs and in the nursing profession. They suggested that understanding these unique challenges African American men in nursing may have can help nurse educators make adjustments to enhance their success. So, as a Black male nurse, what unique challenges have you faced in your educational and professional journey?
So, as a Black man, you're two underrepresented groups in nursing. There's not a lot of men. There's not a lot of Black folks in nursing. And so I'm kind of here at that intersection. So challenges in my career kind of varied, right? You get kind of like these experiences where you kind of feel like you don't belong or, people don't want to work with you. But I think the ultimate challenge that I have to navigate daily is kind of like looking out for how I'm coming off towards other people, right? You easily get labeled as being aggressive or, being intimidated. These are some words that they will use, even towards me. And I'm pretty lighthearted. If anyone knows me, like I'm really lighthearted. I like to laugh. I communicate really well. But you always kind of in the back of your mind have to kind of grapple with that a little bit. And so I just remember even within the last couple of years, I had an interaction with a nursing supervisor, and she was heated, right? And she came at me real sideways, right? And so, of course, as I'm a guy, I'm 6'3", I'm 280 pounds. It didn't even matter what her build was, right? She came off very aggressive towards me, and I'm using that word, yes. Okay. And the first thing in my mind is like, sit down, right? Sit down, because if I'm towering over her as the taller person, it could easily get flipped, and I'm the aggressive person. So I just sat down, kept my mouth closed, and just listened. And then after that, I responded. And so in that moment, I did everything possible so that I wouldn't get labeled. And that's something that I have to navigate every day when I'm talking to patients, when I'm talking to other nurses, when I'm talking to my superiors, is that I don't want to be labeled as this aggressor, because it could easily get thrown that way, especially if you have a really great point or you're right in the argument. People will try to turn it and make you look like the bad guy.
I'm really happy you said that, actually, because, being 6'3", I'm 4'11", and yet people still look at me as someone, and I think mostly because of the color of my skin and the bias or, stereotypes that people think about Black women, that we can be aggressive in our conversation. And I've had a similar situation with a colleague. I'm a nurse practitioner. She was a nurse practitioner, and she was 5'11". Okay, a whole foot taller than me, but she still seemingly had, she raised her voice at me, and I sat down in the stairwell. And it showed me that we have the ability to command, like respect, command, like we have an ability or a light or anointing to change the atmosphere in the room when we haven't some crucial conversations or confrontations with people just by lowering our voice and sitting down. So, like I did that. I lowered my posture in the sense, which is also in commanding action, right? Right. So I'm just happy you mentioned that, because here we are, polar opposite with regards to height. And it still can happen to someone like me who's small. But yes, I am powerful too, and it can be intimidating to people, that stereotype that Black women, and I struggle with it sometimes in my profession, as looked at as someone who is an aggressive person. So I'm happy you said that. How have your experiences as a nurse shaped your perspective on leadership within the healthcare system as a Black male nurse?
So I feel like, one of the biggest things that I've noticed in nursing, and I think also in leadership, is I think that we replicate how we were managed or how we were taught. And that even gets down to if you were in a environment in which you were micromanaged, somehow when you get into that position, you think that's leadership, right? That's management, right? And there's a big difference between leadership and management, right? So the management, I'm looking at the numbers. We need 5 nurses. I got 5 nurses. We have 30 patients. We need to move these beds. Like that's management stuff. Leadership is something that I had to really learn, right? And I got into that position of leadership being in Capital City Black Nurses Association. And I tell a lot of people that because it is a very unique, a volunteer organization being in the area of leadership because people are choosing to follow you. Right. And so it's a volunteer organization. Doesn't matter if it's, ANA or, Capital City MBNA, whatever the chapter is or whatever organization, professional organization in which you are elected into a position is that people are choosing to follow you. Right. And they don't have to be a part of the organization. They could leave and come back if they don't like your leadership or whatever. And so how do you motivate people to follow you? Right.
Absolutely.
And so that being my first experience with leadership has really helped me to excel in my role as an assistant manager is that, I talk to people, I work to people, we all work together as a team. I'm just in a different position. Right. And so I still want to work with you. I need you to understand what's the goal and we're going to do that together. But it's not like this dictatorship where I'm just barking commands at you. And I think that is the experience that's really shaped me as a leader.
Awesome. I love that shaping. And you're right. Like when you're a leader, what makes you a leader is people have to follow you at the end of the day. And following leadership, sound leadership is a choice. Like these are all volunteer organizations, the National Black Nurse Association, Capital City, sector. People can choose to follow you, but we can recognize when we have a good leader and what makes leaders leaders. So we'll talk about that too. But I want to move on a little bit. We kind of talked about it just a little bit about microaggressions. I read an article from the same journal, the Journal of Professional Nursing. Hey, you publish some good stuff. Okay. So they did a study, a qualitative study in 2022 entitled Microaggressions, Black Students' Experiences. In this study, several things were highlighted. Number one, microaggressions are practiced in all areas of nursing education. Mm-hmm. Two, microaggressions have detrimental impacts on students' overall learning experiences. And three, microaggressions are remembered by students after completing their programs. Now, your thesis, now we're going back to your education, your thesis focused on microaggressions faced by graduate nursing students of color. Can you elaborate for us on some of the key findings and their implications for nursing education that you found?
Yeah, definitely. So I had and I guess this is the area where I shout out my person is my mentor, Dr. Kapir Ackerman Barger, who is a professor over at UC Davis at Betty Irene Moore School of Nursing. I had the opportunity to work with her for my master's thesis, which, as you said, focused on graduate nursing students of color. And I worked on a subset of data that she worked on a national survey of nursing students. And I kind of worked on the graduate section of that. And what we looked at is the experience of microaggressions, their impact on satisfaction with the program and association with any symptoms of depression. And what we found was people of color, mostly it started with the highest number was actually Black and African American, experienced the most microaggressions, right? And with non-Latino whites on the lower side. Now, as far as their association with symptoms of depression, across the board, whether you're Black, white, Asian, Latino, the experience of microaggressions was associated with symptoms of depression. And it was also associated with negative satisfaction with your overall nursing experience. So regardless if you experience microaggressions every day or just once or twice a month, it all influences your satisfaction and symptoms of depression. The reason I particularly picked master's students, as we know, is someone like you prepared to be a nurse practitioner. And so as we look into how we address health disparities, we know that the positions beyond the bedside are also very, very important. And so these are our future educators. So the ones that work in nursing schools, et cetera, our future researchers, right? Really tackling different studies or different topics that may not be possible from other people from outside of the community. In addition to that, our future nurse practitioners, as I mentioned, so they're providers. And then finally, our future nurse leaders. So whether you're, assistant nurse manager like I am, which I say is like a lowercase L, or, you're the CEO of the organization, we know that these graduate degrees put you in a higher level in which you have a lot of influence within the organization. And so that's why it's important, I thought, to look at the subset of data particularly focusing on our graduate students, both our master's prepared, our DNP, and our PhD prepared.
Thank you for sharing that. That's all very important. And it just makes me think about another question regarding the retention rate, like what influenced microaggressions that Black nursing students, Black employees, Black nursing employees. How do you think that impacts the success and retention of these groups, sectors of people in their workplace or in their school? What are your thoughts about that?
I understand microaggressions are just a projective of implicit bias, right? It's your belief about a certain different group. And the biggest message I think it sends is not only that you're different, but you may not belong here or we don't expect you to be here, right? And so in my experience, working at the bedside and getting microaggressions from patients, right, is one thing. You can't really control that. I tell people our patients in the hospital are kind of like the mail. It just kind of keeps going. So if I get a patient that assumes that I'm a janitor or surprised that I'm an assistant manager or whatever it may be, I kind of just brush that off. Like that's something I can't control. But when it's within your care team, that's where you start to be at odds with the organization because you're saying these are supposed to be the people on my side. These are supposed to be people that I'm working next to. These are the people that, I will do X, Y, and Z for, whether it's a physician or a nurse manager that don't believe that I belong on this team, or think that I'm less than, or I'm making a really big case that I'm different and they want to let me know that. And so I think when we look at the overall retention, it definitely negatively impacts that, right? And we're thinking about nursing, we're looking at the actual floor within the hospital or the organization, the team that you're on. But when you go down to even the foundational level, when we're looking at education, that's already there. So we already know nursing school is hard. I have not met a person that was like, oh yeah, nursing school is easy, right? But then in addition to that, when you're there and you have all these negative thoughts, it just feeds that. And the example that I use when I went to a school up in Reading. And so the population in Reading, I always talk about it, is like 0.8% Black. Like I was shocked, like culture shock, like someone threw me from a warm pool into like the cold ocean, right? I was in shock. And, everyone was pretty nice. But, I always knew that, I was different. There was a young lady that actually joined me halfway through my program. But for the longest time, I was the only person. And, that's kind of like riddling in the back of my head, right? As, I go in to believe, oh, they think less of me. They don't think I belong here. And then you get little microaggressions. People don't want to work with you, or maybe it might not even be that, but it kind of feeds that flame, right? That's kind of burning in the back of your head. And so those little comments that get fed. The example that I use all the time is, in my first semester, we were like, this is super foundational. We were learning about blood pressures, right? Mm-hmm. That's like first couple of weeks of school. And I remember we were in lab, we were all sitting around the whole class and we're talking about blood pressure, high, low, and different things. And my professor, who I still like, but in the moment I was shocked. She goes, I bet if we took everyone's blood pressure in this room, Aaron would have the highest blood pressure. And right. And this is at a time, and, I'm not a shy person. So, I wasn't like beat up, but if you can imagine another person being in that environment and how embarrassed they would be having that experience, for me, I was like, wow, right? Like, really? Like, that's what we're doing here. So, then it becomes that that fight that you have internally. Like, should I say something? Are they going to see me as being too sensitive? Are they going to, this is a person with power, right? They're my professor. Do I say something or do I not say anything, right? And I really make a comparison to like meeting someone and they have like lettuce in their teeth, right? And you're like, ooh, do I say something? Like I don't want to embarrass them, but I don't also, I don't know how it's going to feel. And so when those things happen, that's how you navigate, right? I remember talking to calling a friend's house. And their daughter answered the phone and I was like, oh, can I speak to so-and-so? And they were like, okay, 1 second. And I hear them go, Mom, I think it's your Black friend on the phone. Right. And things like that. And what do you say? Right. And she like giggles. Oh, my God. And it's like, OK, right. Like,
yes.
Right. And so like these are the stress that you're looking at, and how it turns into performance. It either turns into the student just withdrawing or don't feel unconnected to the students, right? You can't find your community, or in my case, it goes to, I have to show them I'm going to work twice as hard, and I was beating myself down, right? It becomes almost like a stereotype threat where you're fighting to not meet into those stereotypes. You don't want to be the person late to clinical. You don't want to be the person that get a low grade. You don't want to be, and so you're just beating yourself up harder, harder, harder. And I would study harder. I would write. I would finish all my assignments early. And so that's what it turned into, which is also, I mean, some people might see it as positive, but it also could be really negative, right? Like we're allowed to live, right? Like we need to get rid of a lot of these schemas of strong Black woman and strong, all these things that we're trying to live up to, right? Or running away from. And it takes a lot of toll on our body and on our mental health.
100%. I mean, you said a lot right there. A couple of things, one with the stereotype of your nursing clinical instructor, she disrespectfully said that to you, that, to point you out and say, we all know because Aaron is Black and 6'3" and 200 plus pounds. And, likely he probably has the highest blood pressure in the room. That number one definitely is a microaggression, and a complete bias, even if statistics do show related to our history and of hypertension and how it affects disparingly the African American community. That still was a microaggression and disrespectful. So it is very frustrating. And I think that's why I say these racist comments or microaggressions, it's still shocking because people couldn't see. If you're not watching this podcast, my mouth fell to the ground. The fact that you had that experience, and I can relate to that. And, on another episode, I talk about like how to respond, because I know you didn't mention how you responded to these situations, that situation. And then also when you made a phone call and, the child said, your Black friend is on the phone, how do you respond to those? So, one thing I've said before, which you can share with me, what your thoughts are on this is, what do you mean by that? Like give someone opportunity to say exactly what they mean. And am I hearing you correctly? Or is it just something that I'm feeling? And no, I'm not sensitive, but I do want to know and be clear that, hey, you are acting in a microaggressive way.
Right.
What was your response? Or did you go to your community and discuss it? Or did you pull that instructor to the side, or did you not say it? What happened?
So in that moment, I felt like I wasn't very well equipped. I was like, just let it go. And I tell people that all the time about nursing, right? And we know how to operate. I think if there's anything unique about a lot of the communities, at least I would say either in California, maybe the East Coast, is not how we know how to be in mixed company. Like I know how to operate in mixed company, the code switching. And so I understood that. Did I know how to navigate and kind of advocate for myself in the experience of microaggressions? No. I did have, since being able to finish my master's degree and since I focused on macroaggressions, my mentor, Dr. Kapir Ackerman-Barger, really got me involved on the other side of it. So not just talking about our experiences, but like, let's create some education around that. And so she actually has a published toolkit, which I've probably nationed like well over 50 times at different, nursing schools. I've at the School of Medicine, regionally, nationally. We've even had the discussion internationally, just talking about, and what she published was a toolkit to responding to microaggressions. And in those moments, it's really about like kind of upholding and creating community, changing the community, the culture around the experience of microaggressions. Because although that wasn't her intent, right? That was not her intent to single me out or to make me feel that way, right? That was the impact of it. And so the way that they introduce the toolkit is they look at microaggressions from 3 different sides, as a recipient of a microaggression, as a source, and as a possible bystander, right? So if I'm in a class and someone said that to me, you're also hit, right? You're a bystander, you're a witness. You're like, what? Right? And so that experience, so how do we respond, right? How do we create this an opportunity to learn and not make it like a punitive, right, come down on people, right? Because we understand that happens. And as many, it's probably far less, but I do have examples and probably things that I don't even know in which I've been the source of a microaggression.
Yep.
I've been on a podcast and not referred to someone as doctor. Actually, I think it was a live stream, and I didn't refer them as doctor, and it was a woman, and understanding on different levels that even within the profession of nursing, a lot of times doctor isn't afforded to us very often, right? No one responds by doctor. And then even within medicine, we know there's a population that disrespect female doctors, women who are doctors, by not referring to them as doctor, but by their first name.
Yeah.
So in that moment, I apologized. I sent a message and I apologized. I said, I'm so sorry that I didn't call you so-and-so. And she's, oh, I didn't even notice, right? But I didn't come up with a lot of reasons, right? I didn't want to come up with excuses because it's about impact, not intent. An example I use, if I'm walking through the hallway and I step on your foot, I'm not going to look at you and go, oh, I didn't mean to do that, and keep going. I'm going to be like, oh my goodness, I'm so sorry. Right? I apologize because I know that it wasn't my intent to come step on your foot, but I did it. And so I think that's what I really enjoy the most. And I really encourage your listeners to check out the toolkit, just kind of learn how to really shape the culture of, your unit, your organization, your classroom around responding to microaggressions.
Thank you for saying that. And please send it to me and I will add it to the notes for this podcast. So as a assistant nurse manager, how do you approach leadership in a way that actually promotes inclusion and diversity? What's your approach to that?
What is my personal approach? I'm so excited to have the opportunity to work under my director, my unit director, Dr. Kayleen Roseman. And she is literally the first Black woman I've ever worked under in any capacity ever in my career, from bussing tables to pushing bell cards to parking cars. I've never had a Black woman be my leader. And it's been an amazing, experience. And I've learned so much. And I think one of the things that I've learned the most, and I know a lot of organizations have also implemented this, is in making sure that you have a diverse interview panel. Right. I think that's very important. It's also very important to make sure that you are getting a diverse pool of applicants. And so really looking at, hey, make sure I have a diverse group. I want to make sure, and I'm not just talking about race. I'm not just talking about gender. I'm also talking about education, as we know that a lot of our organizations are kind of given a cold shoulder to associate's degree programs, which, I came from an associate's degree program. And so looking at, we understand that many people that go to associate's degree programs, they have to do an additional hurdle of going back to get their bachelor's. And so they should have an opportunity to interview for these large organizations too. Also having, like I mentioned, a diverse group of people on the interview panel. And we like to bring in our floor nurses to come, because really what she says is like, you're all making a decision on people who are going to work with you. You're going to work with them every day. And so it's really powerful to say, I value your opinion as a member of my team, as someone who reports to me. I value your opinion. I value your assessment skills when it comes to screening candidates and reviewing applicants and interviewing. And then looking at your team is like, what is it that you need? How can I get you to where I am? I've noticed a lot of times, and even when I was a floor nurse, is that when it was ready to make a transition to a different unit, like a critical care environment, it was always like secret squirrel, right? You didn't want to say anything. But like for me, I'm just like, hey, where do you want to be? I know that we all don't want to work on one unit for our entire career. If you do, more power to you. But a lot of people kind of want a challenge of learning a different specialty or kind of moving and trying something new. And it's like, how can I be there for you? How can I lay down, stones so that you could take steps, right, towards it? What can I do to help you? Is it write a letter of recommendation? Is it send an email, introduce you to someone? Like, what can we do, right? And that's been powerful. I had a lot of team members that love that. They enjoy the transparency, right? Because in order for me to step into my job, someone had to move, right? Mm-hmm. And in order for me to hire them, someone also had to move. So we understand that within the organization, people are coming and going. And so really looking at how I can help people achieve their goals as individuals and not just members on my team.
I love that, because I heard a few key words that you talked about regarding that inclusivity and diversity with promotion. And that includes, number one, recognizing value, and showing them that they are valuable, right? And also really just asking the questions about their direction and vision for their own selves and kind of helping them to get there. Right. Mm-hmm. So I love that you said that. That's really important. Right. Can you share a little bit more about the barbershop talks and breaking down barriers to nursing initiative, how it positively impacted the community and or your team or organization?
Yeah. So the two programs in, our leadership, Capital City Black Nurses Association was founded in 2018. I came around in 2019. And I think the one thing that I really valued about the organization coming in as just a member was that they were really wanting us to use the organization as a platform. What ideas do you have? What do you want to do? How can I help you get there? And I just remember, meeting Carter Todd and Cherie Kreiner, who were board members at the time. They're still board members. Cherie Kreiner is our current president. And they were just like, what are some things that you're looking into? And I said, well, I had an opportunity to a barbershop event in my undergrad when, I was at the community college. I would really like to do something, in a barbershop. And working with Carter Todd, who he actually did his master's thesis on the perceptions of Black men on the nursing profession. And so working with him, he was like, let's do a barbershop event, but let's do something different. Let's be innovative. Let's do something bigger. Let's do something other than just screening blood pressures and saying you have high blood pressure, you probably got diabetes, go see your doctor, and understanding that there's barriers that exist, right? To access. It's like, let's address some of those accesses. Let's address some of those barriers. And let's really look at if we can start to provide kind of a wraparound service, I guess, approach to the barbershop programs. And so we started gearing up to do a health fair outside of a barbershop. We pulled permits. We had speakers. We were getting a flyer made. And at that time, we were like, let's just get through Black History Month. And so February 2020, we were like, March, we're going to hit the ground running. And what hit the ground was COVID. It really changed our plans. And, we cried a little bit and we licked our wounds and we were like, let's, what we could do? Let's think about another way we could do this. And we ended up leveraging we created a virtual platform. And so we were like, let's change it up and bring the content into the barbershops. So we did a live stream. We streamed content into barbershops. We partnered with our sister chapter in the East Coast. Shout out to Greater New York City Black Nurses Association and Josie Perpigman and Julius Johnson over there. And we were able to stream content from the East and the West Coast. So they partnered with local barbershops. They had a virtual kind of round table of men, right? Like The View, I guess. Maybe, I don't know. The View, I don't know what you want to call it. And then we had kind of the same thing here where we had community leaders come on. It was all Black men that came in and talked about healthcare from lots of different ways. We had social workers, like I said, community leaders, people who had resources and organizations, and we talked about everything, hypertension, diabetes, the whole shebang. And it was really positively received. A lot of people really enjoyed it. We did another pre-recorded episode looking at gun violence. We had a huge shooting in Sacramento. And so we really wanted to give some education about the resources available in the community, both as mental health and for the wraparound services that they offer, particularly at UC Davis, which is our trauma one hospital. So that actually really gave us the footing to launch where we are now, which we have the Cut to the Chase program that's been running for 3 years in partnership with the Greater Sacramento Urban League. Our first virtual event caught the eye of their Chief Impact Officer, Dr. Troy Williams, and he wanted to work with us. And we're like, all right, cool. He's like, I want to do group therapy. We're like, okay, we have some barbershops. He had a concept. And so we kind of vibed together and we launched it. And so we're now in our 3rd year. We are in 2 barbershops. I know, thank you so much. It's the first and second Thursday of each month. What started off as an hour session has now expanded to an hour and a half because guys love to talk in that space. I don't know what it is, but we love doing it. And we have groups anywhere from 5 to 30 men that show up twice a month to these barbershops. They're located in 2 historically redlined areas of Sacramento. And it's free. We got grant funding to connect men with one-on-one therapists. It's facilitated by a licensed therapist. It's been great, right? And I think not only for the community, but it was one of those things where I noticed that it was actually beneficial to me, right? As, a man, as a leader, as a father, as a husband, as a nurse, as a layered student. And just sharing and forming community, right? And the topics that we talk about and explore, and there's men that are at 19, 20, all the way up to 60, 70, and they're all just sharing their perspectives, right? And the therapist is almost just kind of like the Montel Williams, right? Just kind of picking people. And what do you think about that? And what are your thoughts, right? And so we would all just kind of feed him. We just kind of share information, right? We talked about loss, which a lot of people, it means something different, right? To you and I, it might be loss of a loved one. To someone who's 18 or 19, it might be loss of a relationship, right? And so we just kind of shared and really get in on those moments. And it's been amazing. It was in its first year, everyone was raving about it. And we ended up to start a Cut to the Chase Crown Edition for women. So we have 2 beauty salons in Sacramento. So every Thursday, you can catch us either a barbershop, not me, but our the women in our chapter and the beauty salons, and we're just continuously being innovative to what we do in the barbershop. We now started our medical moments where we take that time with the audience to talk about any kind of topic. This month, we're talking about organ and tissue donations. We're able to kind of bring in speakers to kind of talk about it and educate the community. And it is because we've built this trust, right? I've built this rapport with these men that come every single week. They come, right? And there's a value there because we're not offering haircuts or gift cards or anything. So they're coming because of the value of the space. And the trust that I built has helped us tackle some topics like organ and tissue donation, because when I said that was a topic, man, they were like, heck, nah, we ain't talking about that. Like, I'm not going to be a donor. But, having that time for them to open up and listen to me and listen to what I had to say, it really changed a lot of minds that day that we talked about it. And so that's just one of the programs that like kind of what we're doing in the barbershop. And I know you want to talk a little bit about breaking down barriers, but I just want to also be a little conscious of our time.
Oh, no, that's awesome. I'm happy you shared that with me. I'm so happy you guys are thriving from what it sounds like. And that's what I love to see. And if you share with me the links, I will put the links into, my podcast episode taping so that other people can know where to find it. Mm-hmm. Also, another thing I wanted to say, that's replicable. This program that you created, I can even see something like that coming down here. And even I can see something like that, like the barbershop stuff, specifically in Chicago, where I'm from, like the African-American community. That's where we can bring healthcare into where these men are, right? And then I'm also hearing, therapy, counseling. This is healing for people. And, this is wellness. Mm-hmm. And I really love that because our Black men need that, so much. I love your passion behind it. So everyone listening, look out for these links and get connected if you're in the Bay Area or Sacramento area. I wanted to talk about briefly that documentary, Everybody's Shift Work, Healing What Hurts Us. And that's a compelling film by Chad Tingle that examines the impact of systemic racism in healthcare, particularly through the lived experiences of nurses. He highlights that to heal the racism seen in nursing, it will take everyone standing up and speaking out, and that health justice, after all, is everybody's work. Mm-hmm. So, Aaron, you were involved in that. How was your involvement in the documentary, Everybody's Shift Work, Healing What Hurts Us, influence your perspective on healing in leadership? I know the barbershop offers some therapy and healing, so that's kind of why I want to segue into this topic before we conclude.
Yeah. So the Shift Nursing documentary, just big shout outs to Chad Tingle, who you mentioned, but also Desiree Duncan. They were just the 2 powerhouses as both the producer and director that worked on this film. My introduction to the film was just very by chance. I just got caught in the email and they were like, we want to meet with you. I was like, what is this about? They were like, well, we don't really know yet. We're going to make a documentary, but we don't really know what the focus is going to be, which at the time, I'm like, okay, you're not organized. But what it actually was they were allowing our stories to be told, right? Let us tell the story. They didn't come in with a direction. They wanted our stories to be the direction. And so being involved with the film, I was just so blessed to be chosen, or the amount of time that I even have in the movie is amazing because there were so many powerful leaders in nursing, thought leaders that were unable to be in it. And so, or had smaller roles. And so I just also wanted to acknowledge that somehow I brought something different that they were wanting. But looking at the documentary, which kind of focuses on health equity and racism in nursing and like the structural barriers that exist, right? Whether, it be, the overrepresentation, but we do have an underrepresentation of Black and brown nurses, right? But you see a lot more concentration as LVNs. And so there are a lot of structural barriers that exist, even, turning down of associate's degree nurses, in which I shared earlier is, you go through this associate's program and now you can't get into this huge academic institution because they have a preference for bachelor's nurses. And so it addresses that. It just talks about a lot of stories that were shared about even us as healthcare workers, as healthcare providers, interacting with healthcare, both positive and negative, and just the power that nursing has to kind of lead the change, right? We are the largest nursing workforce. When we look at all these systemic issues that are within healthcare, nurses are that change, right? And Dr. Monica McLemore, who, her line is what gave the documentary its name, is she said, it has nothing to do with, not everything to do with, but it definitely does a representation of all groups, positive influences, right? The community, right? Having more Black nurses will help influence the Black community, the care that's provided from hospitals, more bilingual, Latino, whatever the group be, right? Having you present, it really helps with our engagement with that community. But in addition to that, when we talk about leadership, we talk about researchers, we talk about the thought creators of innovation that is missing because we're keeping people back, right? It's hurting everybody. And so when we look at whose job is it, it's not just the Black and brown nurse, it's everybody's work to push forward, right? Our goal is to provide the best care for the community. And we see the science, we see the statistics that really support a diverse, inclusive workforce helps to push that forward, right? Compared to, there was a study that looked at suspensions, high school suspensions and principals. And when they made improvements, right, and it looked like the goal of it was to improve suspension rates among Black and brown students and improve suspension rates for everybody, right? And so that's what we look at for healthcare. And so being a leader, I think sometimes is you have to push back a little bit. That's why I mentioned having Kayleen Roseman as my leader, as I could learn from her and really push back on what we call tradition, right? And someone told me before, tradition is just peer pressure from the ancestors, right? So it's all these nurses that came before me and kind of breaking that up and really questioning, why does this exist? Why do we still have these outcomes? What can we do different? Is this policy really inclusive to all communities, right? So start to challenge that. And leadership, anyone could be a leader. I had 2 patients at the bedside in the ICU. I was a leader, right? I was a leader, right? My title didn't make me a leader. My actions made me a leader. And so I think when we look at everybody's work, I think it really pushes people to move outside their comfort zone and stand up for what's right. And so that was my reflection, my connection to leadership.
Thank you so much. That was powerful. I really appreciate your thoughtfulness. And actually, when I saw your segment, I can see how even sharing your story, probably had some amount of healing, even just thinking about what you went through to get to where you are. And I just want to say this, God is favoring you. So keep going. Now I kind of want to transition a little bit because we're about to conclude, our podcast today. And I would love it if you could share 1 to 2, pearls of wisdom that you hope to convey to listeners today about the importance of Black voices in nursing leadership. Black male voices.
I think one of the biggest things that people always say is like, how can I help move the needle forward? How can I be, I think the word people use is ally, but how can you advocate, right? And I think the biggest thing is to look around at the table and say whose voices are missing. Right. I think really pushing to not only mentor people, which, I had the privilege of being mentored early on, and someone saying, have you thought about leadership? Right. I think that was really early on. Have you thought about leadership? I think you should look into that. Why don't you shadow me for a day? Why don't you see what I do? Why don't you think about what kind of changes that you can make from this position? And so the mentor piece of it is so powerful. And then in addition to that, the sponsorship part of it is speaking names into rooms, right? Do you know anyone with a podcast, right? Do you know anyone? And I could say, I know Dr. Tiffany Brown got a podcast. Like, you should check her out. You need a host, right? And so it's kind of like speaking, right? Sponsoring. I think that we get kind of caught in this loop of, if it doesn't benefit me, then it's not worth it, right? But we all should be doing that. And mentorship comes in all different capacities. There's someone that's probably at home following you on LinkedIn that's like, man, I'm following all her moves, right? I'm right there. And, there's probably someone that you probably have a group of former mentees, right? Someone that you're working with. But then the sponsorship is the other piece of that once we get into these areas of power and influence. And so I think those are the two biggest things. I think that looking at the disparities that we have in certain communities, you spoke about those too, but then also kind of looking at the subsection and looking at the men, right? And how gender plays a factor there, and how it is also nice to have a male voice at the table that could speak to that from that perspective. Is always important. I think that was it. Those are the two things I could really think of. I think that sometimes, we don't always see leadership in certain groups. I'm not really sure if it's kind of like a bias thing, but even people who are unofficial leaders, we're not always uplifting those people, right? And sometimes those people don't see it in themselves.
So true. I couldn't have said it better. But I'm happy it comes from your voice. I 100% agree that you need not only mentorship, but you also need sponsorship. I've said that multiple times. So it's going to be, stuck in y'all brains now, because you need both in healthcare and nursing. Get to a mentor, and then understand that, I pray for those who are allies. We need sponsorship too, to help us, get into those leadership positions. So, well, folks, this concludes this episode of You Belong in Here. Thank you so much, Erin, for being like an amazing guest and sharing your nursing journey from RN to very powerful nurse leader and all your pearls of wisdom. I wish you so much luck in your PhD program. We didn't talk about what your dissertation for that program is going to be, but we'll have to talk about that separately.
Yes.
And thank you all my listeners for tuning in. We hope, as usual, that this episode reminds you that you belong in your workplace. Your presence is necessary. You truly belong in your places of education as well, whether it be LPN, BSN, MSN, DNP, FNP, everything. You belong in there. And as usual, if you found this episode encouraging, motivating, inspiring, or empowering in any way, please like it and share with others. You can find my podcast currently on Spotify and Apple Podcasts. And tune in the next couple of weeks where we continue to explore topics in equity in healthcare and equity in the workplace. Until then, take care and keep pushing forward, everyone.